morning, everyone. My name is Jonathan Fritz. I'm the Chief Innovation Officer for Chime. It's my pleasure to welcome everyone today to our Innovation Beyond the Edge program. This is our second season of Innovation Beyond the Edge. Our first season had 14 sessions, some very interesting topics by many of our members, and all of those are available on demand for your viewing. We've got a really exciting second season planned, and I just wanted to say that the Innovation Beyond the Edge program is really about and designed to share creative problem solving and really highlight the innovation successes that are implemented by your peers. Today's session is pandemic-sized innovation. It's really my distinct pleasure to have a really good friend, Ryan Smith, CIO of Intermountain Health, join us for this presentation. He and Intermountain have been great supporters and partners of Chime. I'd also like to give a special thank you to ClearSense, our supporter for today's session. So we know that you're really busy these times, and we appreciate you joining us today. So just a very brief moment of why is Chime presenting Innovation Beyond the Edge? Quite frankly, all of us are going through some very significant challenges and problems, but also that presents opportunity for creatively, solving those problems. Here at Chime and Chime Innovation, we want to highlight creative problem solving and really highlight innovation successes by you and your peers and share them with the Chime community. So I've got a little bit of a boilerplate here I've got to read through, so forgive me. Before we start the presentation, just like to cover a few details. Our session will have three main parts: presentation from our speaker, Q&A with our speaker, and then third, an optional virtual roundtable session where we'll break you up into about 4 to 6 people per group so everyone can have a candid discussion on the topic. I will note that that is an optional segment, but please consider joining us for that so that you can talk amongst your peers about the topics of today's presentation. We'll have everyone muted during the session. If you'd like to ask a question, please use the chat function to alert the team. Also, please use that chat function to raise any questions that I will ask of Ryan following his presentation. We are recording this presentation. It will be saved and stored on the Chime site, so you can go back and review any details once we finish. Discussions within the breakout rooms for the virtual roundtable discussions will not be recorded. So please feel free to have a candid conversation there. And once again, highly encouraged, but the roundtable discussions are optional. If you have any difficulty listening to the live audio stream through your computer speakers, keep in mind you can connect to audio via phone. If you need help with that or any other technical detail, please use the chat window, send us your questions. For those connecting via phone and your computer, please message the host with your name and phone number. Our host will then merge your phone and computer connections. Especially when you're joining the virtual roundtable through the breakout sessions, breakout rooms, we want to make sure that your phone and your computer are merged. Otherwise, you might be in 2 different sessions. Lastly, by attending today's full session, the presentation and virtual roundtable discussions, you'll earn 1 continuing education unit for CHCIO and CHISL certifications. We will review the attendee list following the session and distribute CEUs accordingly. With that said, I'm going to hand it over to Philip Furukawa, Director of Sales, ClearSense, to introduce our speaker for today. ClearSense has been an excellent friend of Chime, and we really appreciate the support that they have given to our innovation programs, and particularly our Innovation Beyond the Edge program. And they are a series supporter as well as supporter for today's session. Philip, please take it away.
Thank you, Jonathan. Good morning, everyone, and thank you for joining us for what I'm sure is going to be an engaging discussion about pandemic-sized innovation. As Jonathan mentioned, I'm Philip Furukawa, Director of Sales here at ClearSense. We provide a data platform as a service to aggregate and harmonize data for organizations to help achieve their data maturity goals. It's an honor to be sponsoring today's speaker, Ryan Smith. Ryan is the Chief Information Officer and Vice President of Intermountain Healthcare in Salt Lake City, Utah, where he began his career. With a 25-year tenure in healthcare IT, Ryan has held numerous distinguished positions with organizations such as Banner Health and Health Catalyst, as well as served on the board of numerous institutions and advisory boards in healthcare IT. Ryan has a significant interest in promoting digital transformation and our healthcare system through leveraging integrated technology, data intelligence, and reimagining workflows and organizational leadership. Ryan, I'm excited to be a part of the conversation today, and I appreciate your willingness to share your expertise with us. With that being said, Ryan, I'll hand it over to you.
All right. Hey, good morning, everyone, and thank you, Philip, for the kind introduction. Let me see if I can get my screen sharing. Are we good there, Jonathan? Can we see the screen? Okay.
Yes.
So, I'm relatively new back to Intermountain, and I'm not sure I'd recommend to anyone that you take a new CIO role in the middle of a pandemic in our industry in healthcare, but it's been a real privilege to come back to Intermountain after being away for the past 7 years. So to start out, I'd like to take us back, to one of the many unsettling periods during our COVID journey. And you may not have seen this exact headline, but we all remember seeing headlines like these during New York's hardest hit period. And it was probably late March. I was in contact with a number of other CIOs to just check in, see how their organizations were either responding to COVID or getting ready to prepare to respond if their region hadn't been hard hit yet. Talking through this with a lot of CIOs, it was really clear that many of us were preparing for the worst cases as positive cases were starting to far outpace in some of these regions the capacity of their organizations. So it's really times like these where you fall back on your real core strengths. And one of Intermountain's strengths is that we have a long history of innovation. We definitely have our share of notable innovators over the years, but when the pandemic hit, the organization was really pretty well positioned to build on a foundation, around things like leveraging our core strengths around telehealth, our digital front door, our data platform and analytics. But before we jump into some of these too deeply, let's talk just a little bit about the concept of innovation itself. So, I'm curious, and maybe we can tease this out a little bit more in the breakout session today or during the Q&A, but what exactly is innovation? And I know that this particular group has had a lot of discussions on this topic, but let me just share a little bit around my perspective. Generally speaking, I view innovations as new ideas, novel methods or devices that can kind of be thought of, I guess, in three concentric circles of impact. If we kind of start from that outermost concentric circle, innovations can be things that are new to the world. One thing that comes to mind would be something like the introduction of the iPhone. It was a really, really novel concept, highly useful, brought a lot of value, pretty immediate value, to people around the world. That second one would be innovations that are new to our industry. And I like to think of, some of the pioneering efforts that Intermountain and others did around the first artificial heart. I think that's one that's a clear example of innovation. And then third, and innermost of those concentric circles are innovations that are new to your organization. So even if it's something that has already been out there in our industry or even in the world, something that's new within your own organization is still innovation with the way that I see it. And challenge is a lot of us, especially if we're less funded than other, healthcare organizations, et cetera, we struggle to see how we can be innovators. But again, I think it's really important to remember this kind of nucleus circle that if just because it's new to your organization doesn't discount it as still being innovation. Okay. So with that, let's, bring the conversation back to COVID. So while we were maybe generally prepared in some number of regards, looking at the slide here, meaning round holes and round pegs. COVID definitely presented many new challenges where we needed to adapt quickly and innovate new solutions. And there's many examples that I could highlight, but I'm sure all of you have a lot of examples in your own organizations as well. But here are just a few of the representative challenges we face. So let me start with the challenges, and then maybe we can take a couple of minutes and talk about each of these just briefly. So, first of all, testing. One of our specific challenges was collaborating with the state for testing in rural, underserved communities, as well as other hotspot areas. Another one was around community concerns. Our call centers, and I'm sure many of your organizations faced these same kinds of challenges, but our call centers quickly became overwhelmed with community concerns over symptoms, testing, treatments, et cetera. PPE availability, was another one. And like all of our organizations, we also were challenged to understand how long our PPE supplies would last. How could we predict what our run rates would look like, et cetera. Ventilators were another one. We needed to predict if we would have enough ventilators, as well as therapists to manage care. Remote care, with restricted access to many of our facilities, we needed to figure out how to provide care remotely and what tools to use. What could we do in terms of outbreaks to get ahead? How could we identify outbreaks before there were really any visible signs in those communities? And then what could we do to help contain those outbreaks? So let's just take a quick peek at how Intermountain, how we respond to some of these challenges. So, one story that demonstrates innovation here was our quick response around testing. And many of you may recall seeing the Intermountain RV at our HIMSS booth in past years. Well, there it is. We were able to repurpose the RV literally in a matter of days with an IT system, that had access to our electronic health record and other systems, and deploy it into underserved communities to make testing available in hotspots identified by the state. But initially, the mobile testing unit was overwhelmed by public response. And, picture long lines waiting, to come up to get swabs, which is not generally a good thing in the midst of a pandemic to have a lot of people standing around with each other. So the team really focused, again, in a very innovative way, and kind of, thinking about Clayton Christensen's, this notion of what's the critical job to be done, which in this case was to get patients swabbed really quickly. So within a matter of days and weeks, process innovations at the mobile unit resulted in the ability to test over 1,000 patients per day, which was just a remarkable feat. And these process innovations were then spread system-wide across all of our curbside testing locations, that then resulted in reduced wait times and definitely an improved patient experience. Let's talk about community concerns. So Scout is the name of our COVID-19 chatbot, launched on our public website, as well as inside of our digital front door mobile application that we call My Health Plus. And the bot was launched in mid-March with the goal of keeping patients informed and helping to triage patients to the most appropriate care setting. And just some interesting things that came out of this partnership with Giant, the bot maker, that first of all, it resulted in over a 30% reduction in our inbound call center volume, and huge help. Just some other interesting things, that 78% of those were triaged to our telehealth services. 94%. So just some quick numbers here. We had in that, since launching, like 237,000 or so screenings that were started. And of those 237,000, 222,000 were completed, a 94% completion rate, which I think is pretty amazing. And of those, 78% were triaged to our telehealth solutions, like our branded Connect Care, which is a partnership with American Well, or to our COVID call center. So just some kind of cool things there. Also, let's just talk about remote care for a second. So, Intermountain's been working on its telehealth strategy for over 10 years. We have a world-class virtual hospital that oversees patients in our ICUs, our emergency departments, and the partnership with American Welfare urgent telehealth visits. And even with this, when we needed to keep people out of our facilities while still providing care, we found ourselves, somewhat unprepared for the need to provide remote care. So, for example, our video visits went from an average of 120 or so during the entire month of January. So an average of, let's say, 4 video visits per day to over 2,000 per day during that March through the June timeframe. And with the challenges of getting enough PPE supplies, our telehealth team deployed over 600 Microsoft Surfaces across our emergency rooms and ICUs for rounding with patients without having to physically enter the patient rooms. And finally, the team repurposed iPads that were being used for patient education to allow family members to virtually visit and be involved in the care and support of patients in those clinical areas. And these iPads, these repurposed iPads, have been so valuable that our caregivers have actually requested that this become a standard of practice, which again, I feel constitutes as a definition of what really constitutes innovation. So just around PPE, utilizing existing resources like 3D printing, that we had been utilizing for a handful of years, and other capabilities, Intermountain developed rapid prototypes for PPE alternatives like 3D printed N95 equivalents and PPE, conserving solutions like the torso isolation unit that you can see there that allows aerosolizing procedures without requiring staff to be in a PAPR. And when PAPRs started to break down, we partnered with our clinical engineering team to design and 3D print replacement parts that were hard to acquire out on the open market. And when 3D printed ventilator splitters were approved, Intermountain worked with our simulation center to quickly develop protocols for ventilator sharing, which again I thought was really cool. So let's talk about vents and respiratory therapists for a minute. In order to answer some of the concerns surrounding available ventilators, our activity-based design or ABD team quickly developed a ventilator dashboard to be added to our COVID ops dashboard, as well as send ventilator usage and availability data and stats to state and federal agencies. So that's been a big one for us as well. And as our understanding of COVID continued to evolve, often on a daily basis, there's a need to get out in front of community spread and help prepare our hospitals for potential surges that we've seen across the state. And our data science team created what they refer to as a transparent machine learning environment to scan over 3,000 possible variables, such as demographics, medical conditions, geography, worksite facility outbreaks, and then identify the biggest driver of changes during that week. And this micro bursting detection, as they refer to it, proved very useful for identifying geographical and worksite outbreaks prior to our state and county agencies, helping us target community engagement and direct, again, our mobile testing efforts, which may have entailed utilizing the RV that we talked about earlier. And we noticed rapid shifts in age demographics, which allowed us also to modify our projection of ICU demand for planning teams. So a lot going on around this activity-based design. So I think it's safe to say that we're still in times of great uncertainty as it relates to the pandemic. This is true of COVID, the economy, and understanding what the new normal means for us and our organizations. And most of our organizations are implementing cost containment measures to deal with the impact of significantly lower revenues, brought about as a result of the pandemic. So one of the key takeaways today, as a recommendation, is to avoid cutting so deep that we lose the ability to rapidly adapt and respond. It's really in times like these that it's crucial to continue investing in innovation in whatever form is appropriate for your organization. And like many of your organizations, I definitely That was cost containment efforts were something that literally started on my first day back at Intermountain. And so it is a tenuous balance, to figure out how can we continue to be flexible and adaptable and continue this kind of innovative heritage and legacy as we're looking at ways that we can cut costs and in some cases pretty significantly. So with that, working innovatively within and across our organizations, I just share that I'm confident, that together we're going to transcend these challenging times, and that collectively we're going to emerge stronger, so that we can continue to care for our communities, our families, and each other. So that's the end of my kind of prepared remarks. So Jonathan, I'm going to turn it back over to you, and we can start the question and answer period.
Excellent. Thank you very much, Ryan. Appreciate it. So for those that have joined us, please use the Zoom group chat feature to raise any questions you'd like to ask of Ryan. I'll be monitoring that and then raising those questions for Ryan. But Ryan, one of the things I wanted to start off with is that you've got a very substantial size team at Intermountain, and you've got a number of different experiences as CIO, but also working outside of direct provider organization. Can you talk a little bit about how these past experiences are really shaping your view and role of CIO at Intermountain and innovation in that role?
Yeah, great question, Jonathan. Well, maybe let's start with my time at Health Catalyst, as that was my most recent experience. And at Health Catalyst, I had a unique role. It was a new role when I joined the organization, which was basically an executive advisor. So my job was to go out and, lock arms with other CIOs, with data officers, with chief analytic officers, with technology officers, and generally speaking, other C-suite, members, and work with them around their IT strategic plans, how to think about data strategies, how to think about digital enablement and digital innovation. And it was really, really a wonderful opportunity. First of all, I've got to admit, it was a great break from the CIO role. CIO roles, as many of us understand, are very hectic. A lot of fires going on any given day. You're expected to be everywhere, et cetera. So this was really a nice opportunity to be able to, drop in for an afternoon at another healthcare system or spend a day or two with them. And in more of a consultative kind of role, hear, see, learn what they were doing, offer insights. And then it was awesome, because then you could hop on a plane and fly back and not be, burdened with all the great insights you were sharing with them in terms of needing to operationalize, those kinds of ideas. But in all seriousness, I got to see, Jonathan, so many great things. There's so much innovation going on in our industry. I'm sure you see that as well. Yeah, it's probably true. We are lagging other industries, from an innovation perspective, but I really like how fast our industry is getting its arms around things. And I tell you, this pandemic has done more, and I've shared this with other people I've talked with and interviewed with from a media perspective, but COVID-19 has done more to usher in a huge way digital health than the federal government, all the payer organizations, and all of our delivery organizations combined have been able to do in the past 10 years collectively. I mean, it is just astounding how far our industry has matured in such a small amount of time around this notion of virtual care models and the recognition, about the key role that technologies like remote monitoring are going to play in this concept of virtual hospitals and virtual visits. And I mean, and the list just goes on and on and on. If it wasn't well understood by every C-suite member before an organization, the critical role that the data and analytics, decision support, technology, digital technology, et cetera, will play from an impact perspective on our industry, I think it's much better understood now.
Ryan, you bring up a really interesting point, and this is also a question that many members have brought up in how they're preparing their systems, how they're preparing their organizations for the future, and thinking about the opportunity that we have right now to not make what I've heard as referred to as the EHR mistakes of the past, meaning taking a paper record and just putting it into a digital format, and now not to make the mistake of taking a in-person visit and transitioning that to a telehealth platform, and all the remote care, the analytics, and other things that can be brought to that. So maybe you can speak a little bit about how we can avoid those types of mistakes, how we can utilize this opportunity to really improve health and care globally.
Again, great question, Jonathan. First of all, I think it's really important, that we distinguish what it means to digitize something, which historically meant, to move paper and paper processes, to an electronic format. That's what IT organizations have been about since day one. And I think it's very well understood. But when we talk about digitalizing or what it means, to digitally enable our organizations, to me, that's holistically a different thing. In my mind, when we talk about digital enablement, what it really means is this convergence between digital technologies, certainly, operational leadership, and changing operations. So at the end of the day, when we think about all of our brick and mortar, physical processes and services and products that we offer as delivery systems, when we think in terms of moving towards digital, it really means having a virtual experience that not just mimics what those historical, processes have been, but it one-ups, it two-ups, it three-ups, from what a consumer expects in terms of how to interact and receive services from our respective organizations. And again, this isn't something that can just be done by throwing, digital technologies at it. Digital technologies applied to past workflows and legacy operations and things like that is very much akin to just slapping lipstick on a pig. It may do things faster, but it's just as ugly, as that lipstick gets removed. And so we really have to be thoughtful in terms of how we lock arms with our operational partners. And we literally have to redesign. We have to think about patient journey maps and experiences. And we have to fundamentally rethink and reshape what those journeys look like to take full advantage of how consumers want to interact with us and where those consumers are at the heart of these care processes. I guess that's how I'd answer that, Jonathan. And I look back, at my time at Banner Health. When I joined the organization back in 2013, very little had been done from a digital enablement perspective. Very little had been done from true consumer digital experience outside of really a public website and a very basic patient portal that wasn't great. Working with the chief marketing officer there, Alex Morehouse, I'll tell you what a wonderful partnership. And I'd encourage every CIO and digital officer to link arms, with your marketing partner and really rethink what that service experience looks like. We had an opportunity to fundamentally reshape how Banner thought about digital innovation. And as part of that, I'll share with you, one of the things we wanted to get at was the ability for patients to be able to self-service, to self-schedule, appointments, et cetera. Problem was we had over 300 different appointment types in our EMR, okay, just on the ambulatory side. And when you have that many appointment types in your EMR, which some of you are probably nodding right now saying, oh yeah, we've got 400 or we have 250, whatever, because that's the norm, because every specialty area across every clinic basically determined how to set up those scheduling types. So we had to partner with operations and say, we've got to whittle that down. If we ever want to get serious about self-service scheduling, that number needs to be a small handful. And over the course of 12 months or so, maybe 18 months, we were able to take those 300 appointment types and get them down literally to 6. And at the point where you can do that and work through that very difficult operational change management, now it makes it really easy, at least in terms of putting out, digital, tools to your consumers to be able to come in and schedule services. Ideally, we would have been able to get down to 2 appointment types, simply a short appointment and a long appointment, period. But that was work still to be done. So those are just some examples of this partnership between operations and marketing and IT, to really go after digital innovation.
Great. Thank you, Ryan. So we've got a few questions from our attendees. First one from Fred Shepard. How do you close the gap of gaining clear understanding of clinical operational opportunities where technology can help?
Yeah, good question. I think it's that we have already, a little bit of what we've already talked about. Again, it's a partnership, and I don't care if you're trying to innovate around, getting physician profiles online, if it's trying to offer self-service scheduling, if it's video visits, et cetera. You fundamentally, you have to align with and, with operational partners and rethink what those journey maps look like, and really put yourself in the seat of the consumer, the shoes of the consumer. We had at Banner Health, we worked with an outside consulting group around just our digital consumer strategy. And one of the things that came out of that I thought was really, really cool was developing a single persona that mimicked, or basically was a proxy representing all of our patients out there, all of our consumers, okay? Whether those consumers were health plan members, whether they're patients, or whether they were, members of the community at large that we were trying to engage to come in, to one of those former 2 relationships. And the persona that we developed, she was named Sophia. And Sophia was actually a local actress, whose photo we used. We had life-size cutouts of Sophia that we could stand up in conference rooms, put up on stage. And something pretty interesting happened over the course of maybe a year. A lot of decisions that we were making would kind of come back, and people really started to challenge other people in meetings, saying, well, what is that going to mean for Sophia? I mean, if we do it this way versus that way, is that going to be doing it right by Sophia? And suddenly Sophia just took on this massive persona within our organization, to where it fundamentally really started to change how we thought about the customer experience, the patient experience. So at any rate, I just shared that, that was one approach that really started to drive operations and digital convergence to get operators okay with the idea that we can really disrupt how we have historically thought about our traditional brick and mortar in-person, kind of experience, and begin to really reshape that. Great question.
Got a question from Eugenio Fernandez. He asks, did Intermountain have any challenges with IT staffing during these times? And how were you able to sustain IT service levels? And he references an example about having mandatory flex hour schedules for some of their workforce and reduced or mandatory 24, 32-hour work weeks.
Yeah, so, we've been pretty fortunate on the staffing side at Intermountain. in relationship to our IT teams. Okay. One thing that we do have, my organization is actually referred to as CTIS, okay, which is Care Transformation Information Systems. And it was really the convergence of this care transformation organization that played a leading role in our whole, Cerner implementation when we went big with Cerner starting about 6-7 years ago. And that organization came back into information systems to become CTIS. And so naturally, we have a lot of caregivers on our teams, people with clinical backgrounds, et cetera, that are doing a lot of the at the elbow support out in our facilities, a lot of adoption coaching. They're really key into helping, lay out clinical workflows and within our Cerner EHR. That being said, we have run into a lot of those staffing challenges out in the facilities, clinicians, with a lot of canceled, surgeries, procedures, et cetera. And so we have had to go to a lot of flex staffing roles. And as such, the caregivers on my team in many cases have stepped in, on interim roles and on a temporary basis to help staffing with our COVID hotline and things like that, just to be helpful where they can be helpful. So that has diminished, to some extent, our ability to, move forward with some of our other IT projects during that time, but it's been the right thing to do.
Great, thank you, Ryan. Another question that we had submitted from Fred Shepard is that during a heightened event like the pandemic, how do you avoid shadow IT with the medical side of the house? And I know you referenced that you've got a fair number of clinical or clinicians on your team and in your organization. So if you want to answer that question, reference to kind of your organization and maybe to others that might be slightly, different structured without as many kind of clinicians, if you will, on the team.
Sure. Yeah. So innovation is so pervasive across our entire culture. It is certainly not limited to just the IT organization. And that being said, there are a lot of great ideas getting spawned all across the organization. And as you can imagine, and as all of us are used to, a lot of those ideas require, either data enablement or technology enablement or digital enablement, whatever the case may be. And so, I don't think there's any easy answer to how you prevent shadow IT other than you have to step forward and be a really, really good partner at the end of the day. The clinicians out there, their leadership, business operations, the pandemic certainly isn't limited to just the clinicians across the enterprise. You think about needs for supply chain, for corporate communications, for HR, as all these, workers are working from home during these days. I mean, there's just so many areas that the pandemic has stretched all of us and is requiring a lot of innovation to come up with pragmatic solutions. So my best counsel is have that partnership across business and clinical areas such that when they think about needs for digital enablement, data, et cetera, your face comes to mind and your team comes to mind and they want you to partner. And so part of that is, we can't be the yes, but, or the just no, people. We've got to be willing to partner. We've got to be flexible and adaptable. And again, I'll tell you, we have done things here at Intermountain in a matter of days and weeks that historically, given, normal processes for decision making, funding, et cetera, would have taken 6 months, many cases 12 plus months that, we're in essence able to really, really rapid cycle, prototype things, get things out there because we had to. And I know a lot of your organizations have been in the same boat. And so anyway, that's just a thought on that. I don't know if that's a perfect answer, and that is going to differ by organization, but it comes down, I think, to being viewed as that trusted advisor at your IT organization with the way that the business thinks about data and digital and tech enablement.
Ryan, you bring up, the barriers that had existed before and during the pandemic, how quickly things can get done and accomplished. It's one of the reasons why we have our InnoCast program that highlights the partnership between providers and startups, and how quickly they can actually, solve some problems. I'm going to take one last question here before we go into the breakout rooms for the virtual roundtable discussions, and it's from a good friend and fellow Wisconsinite, Jerry Koesters, the CIO at Marshfield Clinic. As organizations have CX teams, CI teams, marketing, operations teams, IT teams, et cetera, what principles do you advise should be established that can guide how to incorporate digital to where ideas are generated? And she gives examples about the redesign process, communication implications to and from patients, operational service design, et cetera.
Wow, yeah, Jerry, great question. I think there's a couple ways maybe to approach the answer here. One is, I have recommended over the last couple of years to a lot of organizations, to a lot of my peers, as well as their marketing officer peers, to link arms and think about digital as a business organization, okay? Because again, it may not be a full-blown P&L at the end of the day, meaning it's probably still a corporate function, but I think it makes a lot of sense to think about digital business as its own thing. I think it ought to have a leg into IT, and I think it ought to have a leg up through marketing, and I think it ought to have a third leg, over into operations, quite frankly, for all the reasons that we've talked about. But to kind of have this, shop that does comprehend everything from, human-centered design principles to UX design to, kind of process reengineering, to all of the, more traditional IT and marketing components that help to support that. So that's one thought, okay? Another one is, and this is something, again, I've shared with a lot of my CIO counterparts, and that is, we all think about IT portfolios, to an extent, and most of us are very formalized from a governance and from an alignment and even from a team composition perspective around key portfolios like our clinical application suite, our revenue cycle suite, our financial business administrative suite, AKA ERP, right? But sometimes we don't think of some other really important areas that should be managed almost, very similarly as an IT portfolio. And I'll just share a couple of those thoughts around those. One would be data platform and analytics. Okay, I think that's an area that needs to be managed as a thoughtful portfolio with full-blown governance teams that are stood up around it, et cetera, lest it just becomes a bolt-on afterthought to all of these other portfolios that we have, and then you end up with 50 different analytic BI tools and data all over the place, and now you've created a big mess. Well, the same goes for digital. And consumer digital experience in particular. I think this is an area that should be thought of as a well-managed IT portfolio area, lest our organizations run down the rabbit hole and you have your pharmacy, services that goes out and just purchases and stands up, some mobile app out on the app store for prescription refills, and then your telehealth services, they go out and do something around virtual visits, and then you also have your historical patient portal, and before you know it, guess what? You have 3, 4, 5, 6, 7, different web apps and or mobile apps branded differently, oftentimes vendor branded, worse yet, that you're offering to your patients. And at a time when every other industry, service-focused industries, whether that's retail, financial services, entertainment, gaming, banking, transportation, you name it, everyone else that's in the service business has figured out how to have a singular digital consumer experience. This topic is so important for our industry that as CIOs, if we don't get our arms around this and help our companies in how to think about this, it's going to be a competitive disadvantage. And so second piece of the answer, Jerry, is you've got to stand up governance around this digital consumer experience so that, at Intermountain, we call it One Intermountain, and as part of our, digital front door strategy, where we want to have a singular consumer experience that spans all modalities of care and health and wellness, so that there aren't a lot of different digital front doors for consumers to come through. But great question. And obviously, it's one I'm really passionate about, so sorry about the long-winded answer, but this one's really, really important.
Thank you, Ryan. Really appreciate it. So we're going to transition to the breakout rooms, and we'll keep the breakout rooms open till the top of the hour and give you a warning in advance beforehand. But I just wanted to thank ClearSense, our supporter for Innovation Beyond the Edge for the entire season, as well as this session. And also, before we transition, I want to highlight some of the Chime innovation programs that are coming up, and also really encourage you to take a look at our significant virtual education opportunities, which you can see on our website and the emails that you get from us on a weekly basis. September 17th, we've got Heather Nelson, CIO of University of Chicago Medicine. September 29th, Zara Vasey from Providence, the Chief Digital Strategy Officer. On October 8th, Tanya Townsend, CIO, LCMC Health, and our incoming board chair. And then Sarah Richardson on October 20th. Chime is also doing a community day with the Health Virtual Conference on October 15th. A really exciting program that we're developing and building for our members there. So please consider registering for the health conference and join us on the 15th. Also, during our Chime 20 digital program, which is November 10th through the 12th, we'll have two new InnoCast programs highlighting Darren Dworkin, CIO of Cedars-Sinai, and Aaron Martin, the Chief Digital Officer at Providence. So please sign up for our Chime 20 digital program, as well as the additional Innovation Beyond the Edge sessions. So in a moment, we're going to split everyone into smaller groups for the roundtable discussions. At that time, please select Enter Breakout Room. That will then enable you to go into those rooms. They will be assigned at random, and you'll have till the top of the hour to have a discussion. Karin has sent out a couple of questions that you can talk about amongst yourself. So please take a few moments to introduce yourselves and begin the conversation. We'll send along, like I mentioned, these questions in the chat window. If you have any questions, use the help button to alert a member of our team, and we'll address that for you. One final suggestion, once in the breakout room, switch to group view to better engage with all participants. And I'd like to take just one final moment to thank our Innovation Beyond the Edge series sponsors, ClearSense, Greenway Health, and Nordic. So we'll leave it open till the top of the hour, and then we'll give you a warning before the breakout rooms will close. So thank you everyone for joining our Innovation Beyond the Edge program today.